Tánaiste, as you know, next Tuesday is the International Day of People with Disability, and last week a lot of us deputies we met a new organisation, the Disability Action Coalition, in a meeting facilitated by Senator John Dolan. This coalition, Tánaiste, is composed of 9 not-for-profit organisations. They're all Section 39s under the 2004 Act, and they include Rehab, Enable Ireland, the Irish Wheelchair Association, MS Ireland, Headway, the National Council for the Blind, Chime, Acquired Brain Injury Ireland and Cheshire Ireland. And together, as you know, Tánaiste, and we all know from our constituencies, they cater for tens of thousands of our citizens with disability, and they employ over 9,000 dedicated staff members. Now, their research shows, and they told us all last week, that they have a funding shortfall of €20 million, at least 20 million between them each year. And this shortfall, of course, is just trying to keep services going. Indeed, they've had to cut services over recent years, including respite and day services, and a range of specialist services for children and adults. And this happens essentially because the amount of funding they receive from HSE simply doesn't match the cost of delivering those services. And of course, they've had additional costs, as you know, in recent years. Tánaiste, there's the issues of pay restoration, unwinding FEMPI. There's additional regulation and compliance costs, necessary costs, but they're there. And there's also, of course, soaring insurance costs, which your government hasn't dealt with. So many organisations are struggling to retain staff because of the difference in pay between the Section 39 bodies, as defined by the 2004 Act, and the Section 38s, the HSE staff. And this adds substantially to training, recruitment, staff retention and agency staff costs, and also lengthens waiting lists for people with disabilities. And of course, they try to bridge the shortfall from their own resources, but that's increasingly difficult. As you know, they deliver 2/3 of our disability services, the not-for-profit Section 39s, and they're contracted, obviously, to deliver vital health and social care services. And in fact, 35% of the disability budget, of the overall health budget, is spent on them. But although they feel they're delivering the same kind of services as HSE staff, they're not fully funded, and their employees are not being treated the same. Now, about 2 years ago, I raised this with you, Tánaiste, and with the incoming Taoiseach, and you did set up in late 2017, of course, the independent review group chaired by Dr. Catherine Day, which reported, I think, early this year. So what I'm asking you fundamentally is, will you implement the key recommendations, especially in chapters 8 and 9 of Dr. Day's report in this regard? They include, for example, deeper looking at the financial analysis of deficits and surpluses of the voluntary bodies. It also asks for a move to multi-annual figures, budgets for 3 to 5 years, and for a forum where the HSE, Department of Health and the voluntary sector, including the Section 39s, can meet regularly and can avoid this annual wrangling over budgets. Lastly, of course, obviously, will Minister Simon Harris now meet the Disability Action Coalition? The emphasis here, Tánaiste, is on action, to try and ensure that this deficit will be addressed, or the deficits the whole 9 bodies have. For example, at the moment, as you know, we're discussing the £338 million supplementary health budget. Is it possible to amend that? Is it possible to amend that to address this matter, or at least to ensure it doesn't re-happen in 2020? Thanks, Count.
This is actually a really important issue. Voluntary organisations which provide services on behalf of the HSE do so on a contract basis under, as you've outlined, either Section 38 or Section 39 of the Health Act 2004. Such organisations provide a broad range of services across the health system, including large, acute care hospitals, specialist hospitals, disability services, hospice care, mental health services and addiction rehabilitation services. Community-based support groups focusing on social inclusion, support and advocacy may also operate under these sections of the Health Act. Service arrangements are in place between the HSE and all service providers, which clearly set out the obligations of the organisation, the services for which they are engaged by the HSE and the funding that's been agreed for that. The HSE is monitoring on an ongoing basis the financial position of organisations who are funded under the service level agreements. The current service level agreement process provides a forum for such organisations to discuss any issues or difficulties with the Chief Officer of the relevant community healthcare organisation. The Minister for Health is aware that some Section 39 organisations have raised concerns in relation to financial sustainability with the HSE, including a number of organisations in the disability sector. the HSE has assured the Department of Health that it is committed to working intensively with such organisations to support them as appropriate to address such issues in the context of the service level agreement process. Where it is identified that there is a genuine issue arising that may impede the effective and efficient delivery of services by Section 38 or 39 social care service providers, any remedial action will need to be considered by central government as a resolution can't be addressed within the current health vote resources. In May 2019, this year, the Voluntary Hospice Group wrote to the Minister for Health asking that all Section 39 hospices be redesignated as Section 38s. I've been involved in that conversation with Minister Harris on the basis that the hospice provide core services not provided by the HSE. As of now, there is no established procedure for transitioning from Section 39 to Section 38 status. Obstacles to overcome while determining how a mechanism could be created that facilitates such a transition could include, obviously, extra cost to the Exchequer, the employment ceiling issues and conditions attached to transfer, as well as legacy and governance issues. But I think this is a real debate. Catherine Day did produce a report. I understand that that's with the Minister at the moment. I think he is likely to implement the recommendations of that report, but I think it's important that he have an opportunity to outline that and the context of the issues around that. But this is an issue that is getting serious government consideration, Deputy.
Thanks, well, Tánaiste, I think Dr. Day and her colleagues, they did set out a roadmap, to overhaul the current flawed budgetary process, which applies to the Section 39 organisation. The outdated funding system in operation now, at least a conflict every year in, year out with HSE, and it ends up once again this year, as every year, with Section 39 services really struggling desperately to keep going. So it is really important, I think, that Minister Harris would meet the Disability Action Coalition, very quickly, hopefully before Christmas, and that he might set out a timetable. I think everybody in the House would agree with that because of the nature of the services. They're so important to our society. Agree a timetable for 2020 to implement these key changes. Obviously, we want to know as well what's happening in relation to pay restoration for the Section 39 organisations. And Minister Harris told me that obviously there is engagement at the WRC on this matter, but the exact costs of the restoration of the whole sector, it hasn't been determined, and deeper needs to get involved in this because it's such a huge burden on the Disability Action Coalition members. And finally, as I said, is it possible, even at this late stage, to look again at supplementary estimate to see if we need more funding for these bodies? It's 338 million at the moment, to add to that and to be able to enable them to balance their books this year, have a situation next year. And Tánaiste, I think one of the key themes has emerged at the Budget Oversight Committee, of which I'm a member, is that we must have realistic, fully costed, fully costed health budgets. Tánaiste, that's critical. Thanks, Karen.
Yeah, and I think we are moving in the direction of making sure that the health estimate is accurate and that we don't have substantial supplementary estimates at the end of each year for healthcare provision. That's where we're moving to, and Minister Harris has made huge progress this year in that regard. But it's difficult because every time I answer questions in this House, people are looking for more money outside of the estimates for healthcare, and we need to respond to that and do. And therefore have to introduce supplementary estimates. But we have to try to shrink that number, to be more accurate in terms of predictions 12 months out, while at the same time recognising that healthcare will need more and more money every year. And if you look at this year alone, the HSE has allocated €1.9 billion to the Disability Service Programme. And to put that into context, that's an increase of almost €350 million since 2016. So we are continuing to raise expenditure in the area of disability, and that will continue as demand continues. The issue of Section 38s versus Section 39s and the request for recategorisation from 39 to 38 is a complex issue for the government. It's a very expensive problem to solve, and deeper is involved in this conversation. But certainly Minister Harris is, and I will ask him if he could meet the Disability Action Coalition. I'd be very surprised if he did
Michael Larry on behalf of the Rural
if that wouldn't
Independent
happen
Group.
before the end of the year.
Tánaiste, you